Hello everyone, happy Friday. Today I'm wearing my favorite Neuro Nerd sweatshirt and I love it. I'm gonna wear this for my exam to get brain powers. Today we're gonna talk about fatigue and MS. Such an interesting topic and things you should know. Last week we started our MS series, so we talked about MS. And today we're going to talk about fatigue in MS. So just to introduce fatigue is one of the most, if not the most common symptom of your patient with MS. And let's define fatigue. So the MS Council defines fatigue, and I'm going to read it, as a subjective lack of physical and or mental energy that is perceived by the individual or caregiver to interfere with usual and desired activities. So fatigue in MS comes easily, and it is present even with small efforts or even after a good night's sleep. Fatigue is there. It is exacerbated by heat and does not often decline very much even after rest. So fatigue is the most common symptom, as I mentioned. So here we're going to talk about 5 things that you need to know about fatigue in MS. So number 1, I already said it 3 times. The most common symptom in MS and the most disabling symptom in MS, okay? Number 2, most of the limitations seen in someone with MS are related to fatigue. And you might wonder, where does fatigue come from? Yes, you know, the muscles get tired and blah, blah, blah. But yes and no. Fatigue in MS is different. So the mechanism for fatigue might be because of, you know, the disease process, because of inflammation, which is our biggest thing, and because of neuroendocrine processes. But here we're going to focus on the immune process. So the mechanism for fatigue or of fatigue in MS has to do with inflammation. So remember from the last video, MS is a disease of the blood-brain barrier, which means that the cytokines are released because T cells and B cells enter the blood-brain barrier, causing destruction of cells, which release the cytokine. So during a relapse, the immune system is activated because this is an acute demyelinating event, okay? So when the immune system is activated, there are higher levels of pro-inflammatory cytokines, such as, I'm going to name you some of them, which you don't really need to know, but just so you know. Some cytokines are called interleukin 1 and interleukin 6. So these cytokines are implicated in the disease and are thought to be the strong mediators of fatigue. Okay, so fatigue has to do with inflammation. Number 3, there are primary and secondary fatigue. So let's define them. Primary fatigue means the type of fatigue that is due to the disease process itself. So, for example, decreased conduction through a demyelinated nerve causes fatigue because they're trying to recruit those same muscles with a demyelinated nerve. Secondary fatigue is the one that you as a rehab provider can prevent. Number 4 is there's a difference between fatigue and fatigability. It's not the same thing. Fatigue is the subjective state of being tired. fatigability is what you can see as a patient is getting fatigued. For example, slowing of gait. If I'm doing, I don't know, straight leg races or step taps or whatever, with each repetition, the quality is decreased. The range of motion is decreased. So things that you can see, that is fatigability. For example, in your documentation, you might say patient demonstrating fatigability signs. Then somebody else reads it and then they know, okay, the quality of the performance is decreased because of the state of being tired. Okay, so that's the fourth one. I actually am going to add 2 more. I said 5, but I think 2 more are needed. Fifth thing you need to know: how do you measure fatigue? So if you want to measure fatigue, like in the moment, how fatigued are you feeling? You do a visual analog scale. If you want to measure fatigue, like overall fatigue over like periods of time, you use certain outcome measures like the fatigue severity scale, fatigue impact scale, modified fatigue impact scale. So just to give you a little review, fatigue severity scale, it's 9 statements concerning the severity, frequency, and impact of fatigue on daily life. The fatigue impact scale, this is a long one, so it has about 40 items. And the modified fatigue scale, it's a shorter version of the fatigue impact scale. And this one is 21 items, okay? So then the last point I want to make here is once you know how to measure fatigue, then we're thinking about our usual activity or pretty much activity outcome measures. So we're talking about the performance-based outcome measures. So the 6th thing you need to know, and this is the bonus one, is that if you have someone with mild disability, MS, because of MS, longer tests are needed to uncover the impact of fatigue. If you do a tug, they're going to do it well, versus if they do a 6-minute walk test or 2-minute walk test, then you will see the change in performance. So you want to tap to that, the limit of I am not fatigued versus I'm starting to be or feel fatigued. So again, longer tests are recommended in people who have minimally involved MS or who are minimally involved. Of course, if you have someone who is, let's say, for just introducing some fancy words, EDSS, which is our severity scale. If you have someone towards like the 6th or like the 7th, you're not going to do a 2-minute walk test or 6-minute walk test because they're minimally ambulatory. But if you have someone who is pretty high level, you can try those longer tests so you can tap to and uncover the impact of fatigue. You want to work with your patient when they're not fatigued and fatigued so you can see the impact. Because let's say someone Berg balance, they're pretty well, they're fresh in the morning, they score 54 out of 56, but let's say later in the day when they're fatigued, they're falling, then that's when you as a PT should come in and see, what's going on, and you want to really uncover the impact of fatigue. Okay, so those are the 6 things you should know about fatigue. Again, summary: most common MS symptom, most disabling MS symptom. Most of the limitations seen in someone with MS are related to fatigue. 3, there's a difference, primary and secondary fatigue. 4, there's a difference between fatigue and fatigability. 5, there are ways to measure the fatigue. In the moment, do a visual analog scale. If you want to measure overall fatigue, use fatigue impact scale, fatigue severity scale. There's the modified fatigue impact scale. And 6, the bonus one, is do longer tests for those patients who are appropriate to uncover the impact of fatigue in MS. Okay? All right. I hope you like this video, and I will see you next Friday.